Hello, everyone. Welcome to my 5.2 discussion PowerPoint and video presentation for the course for NUR456 Senior Practicum for ECPI's RN to BSN program. My name is Casey Glenn, and I hope you enjoy. My project is titled Fall Prevention and Physical Conditioning, a Learning Contract. To begin the project introduction, I first sought out a problem or deficit that the nursing staff or patient caseload is experiencing. Within our intermediate women's psychiatric unit, we serve a patient census whose ages from 40 through 75 years of age. The patients battle psychiatric and mental health disorders on top of the deterioration that the natural aging process causes, such as impaired cognition, physical decline, and abnormal gait and balance issues. The largest concern is the heightened prevalence of falls. Once the problem has been identified, the process of investigation of what actions can improve patient outcomes can begin. I also developed a learning contract and implementation strategy supported by the Plan, Do, Study, Act cycle, also known as the PDSA cycle. By using the PDSA cycle, the implementation process can identify problems, develop a plan, and evaluate the results prior to practicing the method in a routine use. Being that falls are the largest factor that results in injuries of the elderly, I chose a goal with a desired outcome to reduce the fall rates among our patient population on our unit. The goal that I was reaching toward achieving during this learning contract was to design, implement, and evaluate an in-service training program for A-Lodge's nursing staff to improve physical conditioning and fall prevention strategies. The learning contract objectives are: the first one is to create an in-service and quiz based on evidence-based practice materials. Learning objective 2 is to implement the in-service and assess staff's comprehension through a correlated quiz. Learning objective 3 is to evaluate the results and summarize the experience. Learning objective 1 serves as the planning stage of the PDSA cycle. As I began to plan strategies to achieve the overall goal, to complete and provide support of the various learning strategies, diving deep into research was a crucial part to build a firm foundation for the learning contract. I researched articles relevant to fall risks and prevention as well as physical conditioning. To serve as evidence of the accomplishments, I constructed a coordinated annotated bibliography and evidence-based practice guidelines essay. I extracted existing policies and procedures from the facility to gain more insight of what structures are already set in place for nursing staff to refer to. Following the research, I gathered the collaboration with the nursing staff from the 3 shifts. They were able to offer their perceived strengths and weaknesses they have experienced when providing care to our patients. This was very helpful as it got the staff participating and involved with the learning contract as they offered different viewpoints through their personal perspectives. 4 focal factors place our patient caseload at an increased risk for falls, such as physical, environmental, behavioral, and high-risk medication administrations. Using all evidence files I had at this point, I was able to develop a PowerPoint presentation with a corresponding quiz. I met with both my nurse manager and mentor so that they had the opportunity to review all evidence files and grant their approval for the implementation process. To complete learning objective 2, the do phase of the PDSA cycle has been taken into effect in which the in-service was implemented. I was able to present the PowerPoint to 11 participants and later on administered the 10-question quiz to the nursing staff. The study phase of the PDSA cycle followed as I collected the quizzes and began evaluating each individual's comprehension of the teaching method. Specific outcomes for the nursing unit. We were able to identify and remove potential fall risk hazards, implement appropriate fall risk assessments, differentiate which actions need to take place if a patient is taking one or more high risk medications, and to also identify the adverse effects, implement proper physical conditioning techniques when exercising, and also to implement safety precautions when using assistive safety device equipment, such as gait belts, Mary walkers, wheelchairs. Finally, we get to the final stage of the PDSA cycle, ACT. Following the review and analyzation of the results from the quizzes, it was evident that the in-service focusing on fall prevention strategies and physical conditioning was effective. To continue the application of the learning contract, this in-service may be spread throughout the psychiatric facility for the other units to utilize to promote and prevent physical decline during the aging-related process and changes. Nursing staff may maintain the continuity of education as they mentor new staff members to the facility so that they also may be knowledgeable in regarding fall risk factors. The in-service may be used as a reference to physical conditioning exercises to promote balance, range of motion, and mobility. As a unit, we are able to act and put the teachings into play as a part of our normal daily routine. I highly value this project as it serves an opportunity to engage in the process of collaboration, formulating, implementing, and evaluation of current staff deficiency that impacts our patients. I will carry this experience with me as I continue to grow as a healthcare professional and explore further opportunities to benefit the health of others. Thank you all so much for your time and allowing me the opportunity to share this journey with you.